We're here with Dr. Raúl Leal at Centro Médico Zambrano de León and about to interview him about cervical cancer. First question. What causes this disease?
This disease is caused by multiple situations. 90% of the time is caused by human papillomavirus, which will be called as HPV from now on.
How serious it is and how does it affect the patient's lifestyle?
It is extremely serious. Right now is the second leading cause of female cancer in Mexico after the breast cancer. So you have to think of this disease as a very serious situation for a patient.
What is the short-term and long-term prognosis for this disease?
Well, it all depends on the stage of the disease. In early stages, this disease is highly curative. And if you let it progress, then the situation is going to change. But at the beginning, it's highly curative.
What was the chief complaint that the patient had for consulting?
Well, the chief complaint, most of the time you find this disease on a regular female checkup. It's other times the patient has vaginal discharges or it may feel some pelvic discomfort, but most of the time this is a very silent disease that is found in a regular female checkup.
What other symptoms does the patient present?
None, not really. Besides vaginal discharge and pelvic discomfort, most of the time it's a silent disease.
How can the patient be tested for this disease and what does this test reveal?
The regular form of test, it's by a pap smear. What you do is a pelvic examination. You take a pap smear from the cervix and you send it to a lab. That is the regular test for the cervical cancer.
What are the treatment options?
It all depends on the stages. If it's an early stage, you can go by cryosurgery or laser surgery of the surface of the cervix. If it's a little bit more advanced stage, you have to go and do a cone of the cervix, and other times when the cancer has spread, you have to do a hysterectomy or a radical hysterectomy.
What treatment is the patient receiving and how effective it is?
Then again, it all depends on the stages. If most of the times it's a surgical and medical treatment, because when the disease is so advanced that you have to do surgery, you find it also in the lymph nodes. You have to do chemotherapy and radiotherapy.
What will happen if the patient doesn't get treated?
Eventually, the patient will die. If the cancer spreads, it's going to reach some other organs, and at the end of the story, the patient's going to die.
What new technologies exist for preventing, diagnosing, or treating this disease?
It is all related to do a better diagnosis and an early diagnosis. So encouragement goes to the patient to go to the gynecologist, do a pelvic examination, do a pap smear, and be treated as soon as possible.
Thank you very much.